Welcome to the MRCS Bites session on shoulder joint. Today, we'll dive into this topic and explore the common questions tested during the MRCS Part B exam. For more information and full course, please visit mrcsbites.com. What type of joint is the shoulder joint? The shoulder joint, like the hip joint, is a synovial joint of the ball and socket variety. List the rotator cuff muscles and what is their innervation. There are 4 rotator cuff muscles. These may be remembered by the mnemonic SITs. Supraspinatus, suprascapular nerve, C5-6. Infraspinatus, suprascapular nerve, C5-6. Teres minor, axillary nerve, C5-6. Subscapularis, upper and lower subscapular nerves, C5-6. What muscles attach to the coracoid process? Coracobrachialis, pectoralis minor, short head of biceps. What important nerve lies in close proximity to the shoulder joint? It must never be forgotten that the axillary nerve lies in close proximity to the shoulder joint and the surgical neck of the humerus. Consequently, it is vulnerable to injury at the time of a shoulder dislocation, or whilst attempting to reduce the shoulder back into its normal position following a dislocation. It is therefore imperative, from both a clinical and medico-legal point of view, that the integrity of the axillary nerve is documented, both after seeing the patient who has a dislocated shoulder, but also following successful reduction. For more MRCS Part B resources, please visit mrcsbites.com.